If you're getting value from working healthcare, I have a quick ask. Follow the podcast and leave a 5-star review on Apple Podcasts, Spotify, or wherever you listen to the podcast. That simple action helps more physicians and leaders find these conversations and better understand how our healthcare system actually works. And that matters because we can't fix what we don't understand.
You ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. Most people think healthcare innovation means a new drug, a new device, or artificial intelligence at the bedside. But some of the biggest cracks in American healthcare are much less glamorous, like who cleaned the room? Was the protocol followed? Did the right person know the room was ready? Did a new baby's paperwork move through the system, or did it sit inside another paper process? I just interviewed Alan Cooper. He works in the overlooked spaces where operations, accountability, and patient safety meet. Wait for his answer to the final question. It will surprise you. Alan Cooper, welcome to Working Healthcare.
Thanks for having me on.
I'm excited to have this conversation with you because most of my conversations are focused on doctors or nurses or drug devices, insurance, reimbursement, all of the time. But your work focuses on something most patients don't see, like the operational systems that make care possible for patients. So when people ask you what you do, how do you explain it without using software jargon?
It's not easy. I like to kind of make it simplistic by saying that we offer solutions that the back office area of hospitals are able to use to make themselves more efficient, operationally savvy, and helps kind of focus on patient satisfaction and safety.
You did not start out in healthcare. You're really a businessman and an entrepreneur. And when you and I first met, you're like, I am an entrepreneur. So you're not a clinician and you didn't start out in healthcare administration, but what pulled you into this $5.3 trillion a year healthcare system?
Yeah, it's a great question. I got introduced into this basically as an opportunity to start in a small company focused on technology. And I was getting my MBA at that point. I was excited to try something and leverage everything I've learned. And I knew going through my program, I could not go back to a big company. I couldn't. I knew that I needed to do something for myself. I needed to really kind of let my wings kind of like flap in the air and be able to navigate and drive the direction that I felt I knew I could do without having barriers or people in the way. And so I had a friend of mine that actually offered to, he needed help basically working capital. And during my MBA, I helped him get started with a small company called Ancilla, with focus on quality of care. We produce quality metrics for the clinics and the hospitals of the like. And I thought that was kind of fascinating. And I had a technology background and a business background. And I thought, well, maybe I can roll my sleeves up and see what I can do in this space. And so at the end of the day, it was that introduction that allowed me to really thrive in a space that I knew back in the day, I really loved technology, but I really wanted to embrace the entrepreneur part of that technology.
When you entered healthcare, what surprised you the most?
The industries I was in prior were definitely a little bit ahead at that point. And I say a little in kind words. I mean, at the end of the day, the systems I were in, ERPs and the like businesses, factories, retail, banking, all these types of industries had so much technology advancements, their security. There wasn't many industries that I didn't work in that didn't leverage technology to its full extent at that time. And then finding out with healthcare, not that they didn't touch it. I mean, EHRs were spinning up. They weren't as prevalent as they were now, or they are now, but they were at least dabbling in it. But I was a little surprised that what we were doing actually was the forefront of many things out there.
It's insane. We are still using fax machines. I can't think of any other sector within our country that still is so archaic and uses fax machines when we have the latest technology in the entire world when it comes to taking care of patients on the medical side, and on the administrative and operational side, we are using fax machines. Was there a moment when you thought, this system is way more broken than I realized?
100%. And as we started to dive into the quality aspects of the world, you can kind of see where things were and where they could go, but where they were not yet. But to me, I looked at it as more of an opportunity to help elevate this industry. Like I felt it was neglected, and part of it was neglected. Part of it was resistance, right? I mean, I don't know if there's so many technology companies out there that I'm fairly certain would like to get in this space, especially 20 years ago. And I think, frankly, I just think healthcare was a little bit reluctant to jump in. I think they were nervous about HIPAA and some of the compliances of it, and patient, information that shouldn't be spread. And honestly, I think, and maybe you would know more than I would based in your space, but I think insurance probably pushed a little bit of it, frankly, because they wanted to kind of get some of their data more electronic than they did all this paper stuff. So I think if they didn't have some of the payers pushing a little bit of the envelope on that, it's possible we may not be as far as long as we had. I mean, the government definitely had an aspect of it too, with meaningful use and the like. They really pushed the envelope of incenting hospitals and clinics to elevate themselves with EHRs.
I think a lot about that question. Why do I feel that the healthcare sector is so far behind the times? Is it the people who go into healthcare? Is it the people who are working within this system? Is it those who are just taking care of patients and that's their sole focus, or the technology when it comes to devices and helping increase the longevity for people, and they're not focused on the administrative side? So I'm constantly thinking about that, and being the host of Working Healthcare, I really get to dive in and ask those questions. I had a great podcast interview with Holly Miller several months ago, and we focused on the resistance to change within our healthcare system. And is it, again, the people who choose to work within healthcare, or is it something that, the dog wags the tail, or does the tail wag the dog? And I don't know if that question was even answered, but you're an amazing problem solver. And I've seen this reading more about you, speaking to you, learning more about who you are. Did you always want to be an entrepreneur, or did you always want to be a problem solver? Is that just who you are in your nature?
I think so. I mean, from when I was a kid, I was probably doing things earlier than I should be. My parents got divorced early, and I felt like I've always had to kind of do things. I had to fix things. And my dad was also a fixer as well. But I think we always rolled our sleeves up, and we never just threw things away and got something new. We always wanted to dive deep, and why isn't that working? Or I was always want to help people around me. And I'll be frank, I don't always ask for help, which is one of those things that I got to work on.
But you're a man. Do men ever ask for help?
I don't know, maybe the gender thing. I'm not sure. But I do find myself gravitating towards just helping people, and especially when they have challenges and struggle. And as an entrepreneur, I have to balance between knowing how to help my team and letting them help themselves, right? So as a leader, there's something to be said about saying that I'm going to give you some things that you can do to help yourself out of the situation so you can grow. And that's probably one of the things I've learned in the last 10, 15 years is helping people doesn't mean you have to fix and solve their problems. Helping them give them tools, give them advice, give them sharing moments, right? And let them kind of choose what works for them. And that's kind of what we do in technology. I mean, at the end of the day, like when I sell technology, I don't sell it to them. I try to understand what is the problem that you may have. And what I may have may not actually help your situation because maybe that's not the most important thing for you right now.
It's about teaching somebody how to fish as opposed to giving somebody fish, the old saying.
Exactly, exactly. And there's gratification on that because when they actually do start to evolve themselves with some guidance and guardrails, it feels great. I mean, because at the end of the day, they'll start to be a little bit more independent and they'll start to feel a little bit more comfortable and they'll start to progress as a person and not feel as cautious as maybe they might have been before.
So in 2018, you bought out your partner when the two of you had formed a business together. And I ask this because, like you, I don't want to work for a large company. I could never imagine working for somebody else now that I've worked for myself for as long as I have. What changed for you after that when you were the one who was the ultimate person in charge?
It was a lot harder than I thought, frankly, because the piece that was missing was the collaboration. Like I love collaborating with people in general. I love collaborating with my team. I loved collaborating with my partner at that time. And I think that piece was the hardest for me to figure out. I would unfortunately sometimes talk to employees about certain things, about like situations and the like, and not one I would recommend. I mean, it's not good as an owner or a leader to be feeling like you can share everything with employees. There's an element that's definitely appropriate, and there's an element that's not so much. So that was probably the hardest thing. And in fact, that actually drove me to being in an organization called Entrepreneur Organization, where that allows me to talk to peers, people that they don't maybe have the same industry or doing anything I'm doing, but they all relate. Anyone that's an entrepreneur, for the most part, they can kind of relate to your experiences, your challenges, your successes, right? All the things that sometimes it's hard to speak to anyone about if they haven't gone through the same or similar journeys. Even like talking to my wife, like I love talking to her about many things, but there are times where it's challenging to talk to her about my business because right away she wants to help. And I don't blame her. Like I want to help her. She wants to help me. Sometimes I don't want help. Sometimes I just want to be heard.
I love that you're saying that. My favorite conference I ever went to started about 4 years ago when MGMA, the Medical Group Management Association, had their CEO summit and they had just launched it. I think this year may be their fourth year that they're launching it, but it conflicts honestly with one of my very close friends' daughter's wedding. And I'm like, that is where I will be this year. But going back to, yes, it not woe is me. I love being the CEO and I love having this responsibility, but it is lonely at the top and you need to set aside certain conversations for those that are not part of your team, but you definitely want to have the collaboration and have a leadership team around you. And that triggered in me in about 2016 when I finished my executive MBA program, because I really felt the energy from all of the people around me and got some amazing ideas from my cohort and those that I was working with. And then when I came back into the practice, I was like, I got to recreate this in some way. And like you, it's so funny. Somebody else had mentioned Entrepreneurs Organization to me, and I applied a couple of months ago and have like my last stage of the whole application process where I'm going to lunch with a bunch of folks in July, because I do miss that. Why do I have to wait once a year to do it at the CEO Summit at MGMA? I'd like to have this around me all of the time to discuss things that you and I discussed offline before this podcast interview.
No, 100%. And so if I've only been in it for like 18 months, and it really, at the end of the day, their motto is the whole point is to work on yourself. And many entrepreneurs never work on themselves. They're constantly working for everyone but themselves, and they never step back, take a breath, and actually look internally. And at the end of the day, if you don't work on yourself, you might actually be hurting your team and you don't even know it. And I know for sure I was doing things because out of frustration or whatever. And maybe I don't see that it's happening, but I'm fairly certain my team does. And this kind of allows me to step back, reflect, share my experiences, or if I have barriers or challenges, I can share that with a forum of team members that are similar to me. And all they can do is share their experiences. And that's the beauty of EO is they never tell you what to do. The goal is to share experiences, and you can cherry pick the things that actually seem to resonate to you. And then you, again, continue to create your story, because if anyone tells you what to do, they're always thinking that it's got to work for you if it works for me. Like, well, not necessarily, right? So let people tell their own story. You don't have to tell someone else's story.
Exactly. And that is something I'm so looking forward to because I definitely think I'm missing it in my life. One of the reasons I wanted to have this conversation with you also is because you're not approaching healthcare as a clinician and somebody who had worked inside of the system for so many years and then found the problems. You're approaching it as someone who sees systems, inefficiencies, and workflows from the outside. So when you looked at healthcare through the eyes of an entrepreneur, what did you see that felt unnecessarily complicated?
That's a great question.
That's what I work on. Great questions.
I think the biggest thing, at least what I've been noticing lately, and is there are many times that software companies or people with technology solve problems based on what they think they see. And the reality is that most of the time we're solving problems lately is what's being told to us. So like our clients, we used to, not all cases, but many times we would build something and hope they would like it because what we're seeing, like clearly they need this. They're telling, like they're doing this, that, and the other, like they're doing this on paper, or like they're constantly being audited by Joint Commission, and they're having enough paperwork, and they're spending so much time on reports and all this other fun stuff. So, you end up building these platforms that you think, based on what you see on the outside, is they're gonna come and they're gonna want to get what you have. And the reality is that if it's only their burning platform for like a day, they may not find that as valuable as something that is constantly happening moment by moment. So the last few modules for like Rayless, as an example, have been built based on client feedback stating, oh, I wish it was easier to be able to communicate to facilities or equipment to be able to get this stuff into this room right away. Or I noticed that there's a broken knob in this door, it needs to be addressed, or maybe there's a faucet that's leaking, needs to be addressed. And they have systems out there that they use, but they're IT system meant for IT tickets, not for facilities, not for EVS, not for nurses. But, when a hospital buys these big systems, they're not cheap, right? So I get why hospitals want to try to leverage something that could hopefully apply to every single department. But the reality is that not everything works that way. And then there's workarounds that to try to make it work. And so we ended up building something that was like very straightforward, QR code. They scan it, it sends it directly to the person who has the problem, and then they address it right away. There's no 3 or 4 steps. There's no in between where it ends up delaying something for 3 or 4 days. It can be addressed within the hour. So that's where like the clients are telling us, we wish we could do this. Could you help us get this done? And we're like, absolutely. As long as it's reasonable, right? If it's something that's going to cost a lot of capital to be able to do something, if they're willing to lean in to help create that with us, we're willing to do it. But we also want to make sure we're not building something just for one. We want to make sure that whatever we are building, other hospitals can benefit from it as well.
Where do you see the most waste going on within the hospital sector? You don't have to limit it to hospital. You can even look in healthcare because you've worked with billing teams, administration teams. You've worked in the whole support system of the team within healthcare. Where do you find the biggest waste?
I think the biggest waste is probably wasted communication, if that makes sense. I
Yeah.
feel like there's a build-up of these unnecessary communications to get some of these routine things done, right? So for me, it's either sometimes people say they don't communicate enough, and I think that's also, but sometimes it's over communication. Like, you ever get emails that are like 8 paragraphs
Oh
that could
my
have been
God.
said in 3 sentences, right?
Yes.
And I feel like sometimes communication can overwhelm people. And then instead of reading exactly what the problem is, they basically ignore it, or they cherry pick what they might think is important. So I think that some of the waste really is about how do each of the departments and alike communicate more effectively.
Let's talk about the environmental services that you found solutions for. This is really the hidden department tied to safety, throughput, and labor, right? You walk into a facility, you want to know that it is clean and fresh. It doesn't just help patients, it also helps employees because employees want to feel great about the environment in which they work. For people outside of the hospital world, what does environmental services actually do?
Their core task is to be able to clean a room, whether it's a daily clean for a patient that's in the bed, and all that means is taking out the trash, quickly, sweep and mop the floors, do certain things with the room that just kind of tidies it up and makes the patient feel good. Then you have typically the discharge clean. And the discharge clean is really when the patient's being discharged from their room, and now they're going to be able to quickly turn that room over and be able to allow a new patient to come in a reasonable amount of time. And so a large amount of their task is cleaning a room, whether it's a daily clean or discharge clean. Some of the other elements that they do is the non-patient stuff, right? So they have to make sure that they're routinely cleaning the restrooms and the common areas, because those have the highest traffic area. They're the ones that are more susceptible to really infections and safety, because safety in terms of like spills on the floor, or someone spills food, or maybe there's a faucet that's broken and overflowing into the bathroom. A lot of those things are affecting the patient's safety. But if it's not also clean, that's also transmitting certain types of infections that they're not even aware of. Because if you think about it, most visitors come in, they usually go to the restroom, see a patient, leave, go back to the restroom, because they might be there for an hour or two and then go home. Well, there's a lot of touch points during that journey. And if the cleaners are not addressing some of those common areas in a more high frequency basis, that's kind of where infections and it starts to spread beyond just the hospital. But the general sense of it is they kind of do that. The other element they do is floor care. And what they mean by that is either typical daily maintenance of a floor, mopping it, scrubbing it. Nowadays, there's a lot of machines out there that they're leveraging to be able to do that more efficiently and faster and probably even better. And then sometimes they have projects of stripping this whole area of floor because it needs it's been such a buildup that they got to do a better job. So they, again, infection part and patient safety is improved. But those are kind of the two big elements.
Do you believe environmental services is one of the most neglected departments in a hospital?
I think they're typically the ones that are underfunded. That's probably the best way I'll say it. Mainly because, they're always going to focus on the providers first, because without the providers, you can't treat the patients. So that makes sense. But, you got the provider aspect of it, you got the administration part of it, but then you got the EVS and facility areas. At the end of the day, they're all important. There's not one less than the other, because if you don't have environmental services, Well, doctors can't do their job then, because doctors are not going to try to clean up after themselves, any of the equipment that they have to deal with. So they rely on other individuals to do that job to the best and to the exception. I call it like the excellence that they do for their patients, right? So both sides have to be able to come to the table and bring excellence to the patient.
I'm thinking of supply and demand because there is a very rare time within my community, and we have multiple hospitals in our community where they are not overburdened by the number of patients going into the hospital system. And then they're understaffed. So we have a huge demand and a short supply. And I can see that turnover would definitely impact the ability of patients getting into a room, right? Into the hospital or even the maternity ward. Maybe the woman is stuck in L&D and she can't move over into the recovery room or OR, right? You have surgeries that are delayed and the doctor is sitting there like, what the hell? And the patient who's scheduled for surgery can't get in because things aren't turned over. And I know that is what you saw, and you wanted to create a solution for this because hospitals are under such intense labor pressure. Can better workflow design actually help with these staffing shortages?
Absolutely. For many reasons. One is when you bring on EVS personnel, like a staff cleaner, into their role, sometimes they're coming into this facility with experience, and sometimes they're not. And I will say that more times than not, they're not. They hire young. Because eventually, once they get more experience, they may go get their chest certificate. They may try to move up to supervisor, manager, et cetera. Or sometimes some of the cleaners, really, this is just a summer job, or this is a 2-year job as they're going to school, or this is just a point-in-time job because I need a job, right? There's many reasons why people are going to this position. But because of all those reasons, there's a high turnover. And because of that high turnover, you need to be able to provide these individuals the ability to know exactly what's expected out of them every single time. There needs to be this routine, this constant routine in their face, so they know exactly what is expected of them. They know without question, if I go to this unit has different requirements than that unit. You cannot expect individuals that go into these roles with this least amount of experience to be able to do what's expected of them without some type of tool to support them. So either what will happen, they'll do it wrong. So then the supervisor goes back in there. Either they're going to fix their problem or they're going to make the cleaner go back and fix the problem. Well, what's happening there is you're taking 2 resources to do one person's job. 2 is you're delaying something else, right? And that's that whole delay of something else. So if it can't be done right the first time, notoriously, it's going to delay. It's going to be the backlog. It's kind of like thinking about an airport, right? If there's one delay in one airport, I guarantee you, whoever's going to be on that plane the rest of the day, it's going to be delayed. It's very challenging at times to catch up. Now, they may be able to do it because they can go like 100 miles more an hour type of thing, right? Well, cleaners can't. Cleaners cannot catch up. It's very challenging to do so. So if you can't get it done right the first time, it's very hard to catch up. You notoriously have to push bodies onto it. And what'll end up happening there is other people won't get their stuff done, or floor isn't being done. Like, other things are not going to happen and be done because they're not equipped to be able to do their job routinely the same way every single time.
What does proper accountability look like? What solution did you create to solve this challenge?
We have it where Raylist, as an example, has the module where the cleaners actually have to look at a list of check items, protocols that need to be followed per room based on the unit. And it is expected of them to be able to look at these things and understand each of those. And for those that maybe there's a little bit of a language barrier, or maybe they're new and they don't even know what this equipment even looks like. So it says this equipment, but I don't know what this is, or I don't remember what this is, or I'm put in a situation where I didn't get trained on that quite yet, but because we're short staffed, I still have to do it. We have photos and the like to actually share with the cleaner. Oh, this is what this looks like. We also at the end let the cleaner understand, what does a good clean room look like? We give them a picture example. This is what it should look like. And if yours doesn't look like this, then you got to go back and address it. So at the end of the day, we provide this checklist so that then the supervisors truly understand what is actually being addressed, because the supervisor can come back and actually do an inspection on the exact same room with the same protocols to ensure that it get followed or not. Did anything get missed? And then they can actually then rate the cleaners and let them understand where were some of the deficiency, where are some of the gaps. And then at the end of the day, supervisors and managers have reports to be able to proactively understand, we have a few cleaners that might have to be retrained. Let's get them trained. Or maybe they just need more support. Or maybe there's like 2 or 3 protocols every single cleaner is missing. Well, maybe something's wrong with the protocol. So at the end of the day, this allows them to collect data to be able to act on that data.
And it seems so simple, but that's because you are a problem solver. And I liken it to my son, Ethan, who is also a problem solver. It's why he decided to study mechanical engineering. But I remember the first summer that he was working for Sazerac he lived in Louisville, but I think he was working just across the river. And he worked at the plant where they bottle Fireball. And there were like 9, I know, I saw your eyes perk up. There were like 9 bottling lines, and they bottle for a lot of different spirits. And his job that summer was to observe and see where there was a break in the system and figure out if he could solve the problem. And after several times of watching, he saw that these lines would break for hours and they were not restarted, and it was causing a huge bottleneck. And so he realized it was stopped because everyone was searching for the tools. They couldn't find the tools anywhere. And so by the end of the summer, he had created a pegboard for each of the 9 bottling lines with all of the tools that are needed to fix that particular bottling line. And he outlined them all in marker and he labeled them. And so at the beginning of the person's shift, they made sure that the pegboard was filled appropriately. And then at the end of the shift, all of the tools were put back and it was set up that way. And he visited a year later and they were still using it. And that's so simple, but and it seems so obvious, but I think it really takes somebody, sometimes an outsider, to look on and say, hey, where is there a break in the system? Where is there a bottleneck? How can I increase operational efficiency? And so what you shared about these environmental services may seem so obvious, like let's communicate, let's show pictures, let's set expectations. People are missing it. Do you agree that it helps sometimes to be outside of the system and coming in as an outsider and saying, let me take a look?
100%, because I think every business is like that, right? So like I can see someone else's deficiency because I'm not in it. And I'm fairly certain those looking at my business can see many deficiency because they're not in it, right? So I think it makes a lot of sense because it just things that seem just common knowledge seem to kind of highlight themselves more vividly than it would be if you were in the moment.
And you are not limited to hospital room turnover. Like that's not all what you do is environmental service. I called you a serial entrepreneur, but you are constantly creating new companies. And I was shocked to find out that we are so archaic that we are still processing Social Security cards and birth certificates by paper, the same way we did it when I was born in the 70s. But you created a digital way of processing Social Security cards and birth certificates. Explain what it is going on in many hospitals and states now and what your solution is.
That's a great question. So I would say that a hospital right now that is not using our platform, they're basically giving a patient a call it 2 to 5 page form, depending on the hospital, for the patient to fill out after they've done their delivery. And the items there is what's required from the patient in order for the hospitals to be able to submit on their behalf Social Security number and birth certificate. And this is all done on paper. And at the end of the day, this is going on forever. And I think it's because if it's not, in the eyes of some that I talk to, if it's not broken, why try to fix it? So the challenge there is like, it doesn't have to be broken. Like that process doesn't have to be broken, but the downstream one is broken, right? And I think that's where there's sometimes a disconnect. So like the front end nurses and the like that are treating the patient, it's a very simple process. You give it to them, you take the sheet back, and then you hand it off to a birth registration person, and then they have to try to read what was just put into this document and then be able to enter that into vital records so they can actually submit for the birth certificate and social security number. Or they don't get the sheet back, right? So at the end of the day, like sometimes people are always looking in the right area to know that there is probably a problem with the workflow in general, right? So what we try to solve for is how do we give hospitals back time on items that are adding zero value? Doing this process adds zero value. It's a requirement. It's something that must be done in order to get your birth certificate and social security number. Done, right? That's it. So then if they're challenged with resources to be able to do the job to actually get the data into the system itself, I thought, well, why don't we empower the patients to be able to fill it out electronically? As long as they're filling it out, doesn't matter if it's on their phone or if it's on a piece of paper. If anything, I think most people would rather they're sitting in their bed, maybe they just got done nursing. They don't want to be stretched over trying to fill out a paper document. They love being on their device, whether it's their tablet or their phone, and they can fill it out right away. And guess what? If they forget to fill it out, we will notify you gently next day. Hey, we noticed you didn't fill this out. Can you please, finish up or whatever? With a paper form, there's no reminders, notification. It's the expectation of the bedside nurse that they better remind them. And what if they forget, or what if the handoff never happened? And I'm sure they have protocols to make sure that doesn't happen. But this just, again, takes that stress and burden off those bedside nurses because, again, there's no value add for them having to do that extra step. Their value add is treating the patient. The patient isn't feeling well, or they need medication, or they need help with their child. Let the nurses do the job that they're meant to do. Filling out paperwork for the state isn't adding anything other than it's required for them to do it. And that's kind of how that kind of got born, is be able to take away some of this manualness, streamline that process, and be able to take a process that may take up, between the patient and the hospital, 30 to 35 minutes to do. And we shrunk it down to probably like 10 minutes in total.
Not all states allow for the mother, the father, the parent to be able to process this paperwork with technology. Why?
I just think that the systems that the states have, some of them are evolving and getting better, but they have old systems, and they don't have systems that allow any types of interfaces to the hospital, things that be able to collect the information more efficiently. And they're definitely not offering anything in the front end of it, because at the end of the day, if you look at it from their perspective, because I try to look at everyone's perspective, because everyone has their reasons of the why. Well, their reasons well, it's required for you to do it. Why should the state have to pay for a system to make it easier? So that you just kind of pass the buck to someone else, right? So if it's required for the hospitals to do it, well, now it's a hospital burden, right? It's not a vital records or DHS anymore. It's a hospital burden. And that's what I'm trying to solve for, is how do I help gain time back for the hospital, because they have other things that they could be doing better.
It just shocks me that we are in the world of AI right now, and we are on the opposite side in healthcare in many ways, and on the state side, where we're still dealing with faxes and we're still dealing with paperwork to obtain a birth certificate and a social security number. It is insane to me. So all of that technology is changing, but that doesn't seem to be the hardest part. The hardest part to change seems to be the workflow. You have said changing habits is one of the hardest parts of the work that you do. Why?
I think you and I have bad habits or habits we could.
Oh, maybe you, not me.
Right?
Come on, Alan.
Well, I know I do, right? So like, I think habits are hard to break, and I think new habits are hard to create. And I don't think anyone in the hospital setting is any different than anyone else, right? So at the end of the day, if you can help make something more routine and you do it with like baby steps, like a lot of it is like change management with these types of things. How do you allow for adoption on these things where they can embrace it and feel like, wow, like this is like amazing. But sometimes there's a little bit of resistance because, well, who are you and why are you here? And, like, unfortunately, like there's probably not always a great taste in people's mouth of vendors in general or business partners in general, because sometimes you get one bad seed and then it impacts the way you view it. And so what I try to go into is I try to do a lot of pilots. I try to do a lot of things saying like, listen, like this isn't for everyone, but it's probably worth at least a try, right? And like there's no cost to you. It's cost on me for you to try it. And if it doesn't work for you, we'll move on, but at least you gave it a shot. And for those that at least trying to give it a shot, there hasn't been one that has turned back because it seems like a slam dunk, but people are cautious and people don't like change.
How do you win over the person who's like, the old way works just fine?
I don't win over everyone. I'll be honest with you. I try. I think I win, like I'm probably batting 600, 700, and I'm okay with that. I think that's a good number. I think what ends up happening though is those that are maybe not really accepting that right now, they kind of wait for their peers to do it first, and then they get a little bit more comfortable. There's a lot of health systems and people that talk to each other, and when someone starts to talk about something that is amazing for them and they really want to try it, that goes a long way. They trust their peers more than they're ever going to trust me. So, I mean, the biggest thing I do is I advocate for anyone that's been using it, if they can help me advocate, not sell it, just kind of like share your experience. Like, has it been working? Why is it working? What have you noticed different? And if they can testimonially say why, it's an easier way to break through some of those barriers. But it doesn't work for everyone. I think some people at the end of the day, even if they find it's the best thing ever, it's not a priority right now, Alan. I get it. Maybe they got something else going on that is just a little bit more pressing for them at that time. And I respect that. It doesn't mean I won't still try, but I do respect the fact that, it's no different than I get emails from people all the time trying to sell me something. And if it's not a top of my priority, I usually don't give them much time. And maybe I should, but I don't. But I give time for those that are like, there's something is an issue now, and all of a sudden I'm like, oh my God, what is that one person? Then I usually kind of go, and as long as they treat me well and they respect me, respect my time, they're not forcing themselves on me. I try to do the same approach to others that I work with. Is I don't try to force myself on you. At the end of the day, I just want you to know I'm here. I'm here to help you when you're ready, educate you on what's out there. And if you choose to want to go with me, I'm there for you.
What advice would you give the hospital administrator sitting on the other side of the phone or the desk who's looking at solutions right now and is saying, I need to do something to help with my workflow bottlenecks? What kind of software should I buy? Where should I go seek out a better solution? What advice would you give them?
That is a good question, because at the end of the day, with hospitals, there's so many different types of technology out there. I honestly feel bad for them in some ways. I think having an independent consultant would be my recommendation. Typically, someone that has a good track record, reach out to a peer hospital of yours to see if you can get an independent party to help you assess your situation. I typically am not a big fan of jumping right to any type of vendor because they're going to attempt to solution your problem for you, and it may not be your real problem. So my suggestion is attempt to get an independent party, again, recommended by health systems or hospital peers that you know.
When you see hospitals struggling financially, where do you think those leaders should look first?
So consultants not an option then, right?
Yeah.
I would say LinkedIn, that's one of the things that I really like is some type of network that allows you to see testimonials and the like that is out there that can help guide you through some of those things that maybe a consultant can do for you. I will say that ChatGPT or Claude, leverage some of those AI tools to give you at least a baseline of some of these things because they do a good job of at least like aggregating this information for you. I wouldn't say that that's the Bible or the gospel of anything, but it definitely is a great start to at least educate you on what might be out there to help you through some of your situations. I do that now with a lot of stuff I do. I don't take anything without affirming that it's actually correct, but it's definitely a good start.
I'm glad you mentioned ChatGPT for this because I've been using it more and more when I have no idea where to start. And this is actually on my personal life and my personal home. I needed a repair and I was like, I have no idea where to go. And I can look in this whole Tri-County area. And I was sharing this story with somebody who said, you should never use ChatGPT for something like that because people pay to advertise. And so their companies always come up first. I don't know about that. Are you aware?
Oh, I wouldn't doubt it. Nowadays, I think the Google of the world is kind of like secondary, and we do Claude. Everyone's pumping in money to be able to. It's all about putting enough information for the model to think that it should do this. Like the model is not smart enough to know what it's trying to do. It just takes information as it's given and it does its job, right? So there is something about that people should be cautious on, but I do still think that there's some, at the end of the day, it's something better than nothing, honestly. Like I still use it. I use actually probably Claude a little bit more now lately because it has some things that are a little bit more deeper than ChatGPT, but I do find that it is a useful tool to use as long as you recognize that it's not the truth. Like it's not the full truth. Just take it with a grain of salt.
What kind of software are you seeing out there that is really attracting the healthcare community that really creates value?
Well, ours, of course.
Of course. But I'm just thinking because I'm revving up into the fall season of all of my healthcare conferences, and there are hundreds of vendors that are out there. And last year, when I was at MGMA, and I go to way too many conferences in a year because I also speak at a lot of healthcare conferences. So I probably have 12 on my schedule already for this year. And so people come up to me. I hate it. I feel like I'm walking through like a used car lot sometimes when I go to these conferences and check out all of the vendors. But most of them were AI driven last year, but there's so much software and I get overwhelmed going, oh my God, I would like to be able to incorporate all of this and learn about it, but there's a finite amount of time that my staff has, and there's a finite amount of time that I have to really investigate. So I'd love to know in this healthcare world, what are you seeing this year that really is bringing value to those who work within healthcare?
From a technology perspective, the biggest thing I typically see more relates to like robots, to be honest with you, things that are trying to automate what a human can do that's not adding a lot of value. To me, I've seen more of that type of stuff coming out. To be transparent, That's a lot of ES world stuff that I focus on, right? So anything that helps kind of the staff be able to do something that doesn't require a human, I've seen a lot of that really kind of pick up the pace. It's like the whole like Roomba thing, right? Where now it's just kind of taking care of those floors and then they can focus more on the turnover stuff. So, but outside of that landscape, I don't investigate as much as it does in the world that I'm in.
Any kind of software that you think healthcare should avoid? Anything that you're seeing pop up and you're like, oh my God, I really hope this doesn't anchor into the healthcare community?
Not that I can see at the moment. I get always a little bit nervous about, I think the biggest fear I have, it's not for any particular software. It's how the software is being created is more of my fear. I think a lot of individuals feel they can build their software using ChatGPT or Claude or whatever, and then introduce that to the world. That makes me nervous because if they don't have actually a background to know how some of these things work, and you're going to start to make that commercial, that's the software that makes me more nervous than anything else. And I don't have an example of what that might be, but if I was in the shoes of an administrator trying to make those decisions, I would definitely ask, how's your back end? Where's your support on this thing? Like, what's your balance of leveraging AI versus actually there's humans actually kind of like controlling what AI is doing, if that's what you're doing. So to me, it would be making sure there's an appropriate balance of AI and people.
What would you tell leaders who only think about innovation in terms of the clinical technology?
I think that they should think broader. Obviously, I think clinical technology is always going to be the forefront of everyone's mind, and it makes sense. I get it. I just wouldn't avoid some of the opportunities that are out there for like environmental service, as an example, where it could also help them, and maybe it's not directly helping them, but it is indirectly going to help them that will pay dividends.
You often talk about helping the underdog. Who do you think the underdog is in healthcare right now?
I still continuously always think it's facilities or environmental services. I think those are the ones that are constantly fighting for budget. They're constantly the ones justifying their staff, which is challenging. It kind of in some ways distracts them trying to get their own jobs done by always constantly justifying and it's also tools, resources, whatever. It's their overall budget. And typically I've seen, and I know every department is also getting hit by this, but I think EVS typically will say, whatever your budget was last year, is there an opportunity to slash it this year? And that feel like that's a constant challenge.
What keeps you doing this work, Alan?
People smiling and really, when I talk to clients that really just say, this is like really helped, like in a genuine way, help me and help my team. And I've had a few that tell me that, and that makes it all worth it, because I feel like I'm not just doing it for the sake of doing it. It's really actually helping people that I care about. And then when they share that story out there, I don't know, I just like helping people, and it makes me feel happy when they're happy.
I feel much gratitude working within the healthcare sector because we are helping patients, right? I always say, you help patients, you help doctors. If you help doctors, you help patients, and you're going to help the entire healthcare community. We're not selling widgets. We're actually in this health care world in which we're doing something to improve people's lives. So 10 years from now, if we can fix these hidden workflow issues, what do you hope hospitals look like?
Well, I do hope that there is a leaner thought in general, but that means that there has to be a better workflow on how they manage their communication and their data. And in order for them to do that, they have to, in some ways, open their eyes up into knowing that they do have deficiency and being open and honest with that. But at the end of the day, I do believe that I'm hopeful there's less people doing the same on a job, not because I want to take anyone's job, only because we're so short-staffed. My concern is we're not going to get better. I think it's going to get harder. And if we don't find ways to do the same thing and better with less, I don't see healthcare getting better. So I'm hopeful in the next 10 years is that we constantly find ways to do the same amount, if not more, with less. And elevate our people. And in some ways, I think we've done this in every single industry out there. Is just because we eliminate X, Y, and Z does not mean there's more opportunities. There's always more opportunities. Just the opportunities are more elevated. We're pushing people. We're making them think beyond what they are today. Why not have society feel like we can elevate everyone?
Let's talk about elevating everyone. Let's talk about making the American healthcare system better. If you could create one change, because I'm handing over the magic wand, if you could create one change within our American healthcare system, what would that one change be to make it better?
I personally think that there's something wrong with educating our patients and how they should treat their medical needs in the right way. I find the education part of it is the reason why people are in the ED and they shouldn't be. They don't maybe understand where their avenues are. And I truly think that being more transparent and educating the common person where they should go. Like, as an example, we went to urgent care for our kids for a few times and things. And I cannot tell you how frustrated I am when I go to the urgent care only to be told to go back to the ED. And I'm like, why? I should be going to urgent care for this thing. Like, yeah, but this is a little bit deeper than I thought. So now you're making me navigate over here. And now what they're doing is they're training me to go to ED right away. And I'm not sure that's the right solution either. That's a very costly solution. So I don't think that healthcare educates the common patient enough to know what they should do with their health. I really don't. I mean, to me, I really wish that somehow there could be more of a guidebook. It sounds silly, but something that you could use so then you can be better informed and where you can go to be able to be treated in the best way possible, in the most efficient and costly way too. Because at the end of the day, all the patients are paying a lot of this at this point. It is completely shifted in the last 20, 25 years. So I'm very cost conscious right now. And I'm not trying to go for the cheapest route. I'm trying to go for the best value. Where can I spend my money the best that's giving me the best healthcare and not have to break the bank every single time? I think everyone needs to be thinking like that, but they can only think like that if they have some type of road book or something that helps educate them on how to navigate that journey. I feel as if you and I are in a fortunate spot. I was in the RCM world to understand a lot of what's going on. That is, I feel like you open up the cover. Most people don't see what's going on underneath the covers. And I really just wish it was a little bit more transparent.
I love that answer. I've not received that answer in the past. And it is the reason why I started this podcast, because the motto is you can't fix what you don't understand. But I focus on healthcare executives and the CEOs and those working on a higher level, right, inside the system. But I love that idea about the patient experience and aspect. I have a friend, Chuck Melendi, shout out to Chuck, who started a podcast, and it's called Disruptive Dialogue. And it is all about educating patients to understand the system. So while I'm focused on those who work within the system, he's very much focused on the patient who is using the services. And I think that's the way we're educating. But I love the idea of the book. The only challenge is I think it needs to be updated daily. There's so much change.
Some truth to that, but I feel like you got to start somewhere. There's got to be something to help the patients navigate through their healthcare.
Alan Cooper, thank you for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.